Hi everybody, this is Michelle from Virtual Hand Care, your online hand expert. So here I am almost 2 days out of the surgery and I'm actually doing pretty darn good. Now yesterday, not so good. I think day 1 is never the best day for most people, and oftentimes day 2, 3, 4, and 5 might not even be very good too, depending on what type of surgery that you had. Now for me, I just had a lipoma excision. So a lipoma is actually a fatty tumor. It's just a mass of fat basically, and they've removed that. So they didn't have to go digging and scrape any bone or repair anything. So my recovery is going to be a lot better, a lot faster than many of you that may have had a rotator cuff repair or a broken bone in your arm, in your humerus or something like that. It's going to look way different than mine. However, I do want to kind of talk to you a little bit as far as what my surgery day was like and what day 1 was like for me. And I can't say that I don't have any kind of pain or discomfort, because, well, I still have an incision and that is still healing. And I can definitely feel a difference with my incision today than what I could yesterday. I feel like a little more tightness setting in, and I think I'll probably continue to feel that as my body is really working hard to try to close that scar up. So usually around 3 to 5 days is when your body is really working hard to close the incision, and then it can go on to that next phase of healing, which is where it starts to really work and heal on the inside. So I wanted to share with you a little bit about the day of surgery and what happened yesterday, day 1 of my recovery. I got a phone call the day before I was supposed to have surgery, and I got a phone call around 1 o'clock in the afternoon saying what time my surgery was for the next day. That part I didn't really like, because I really didn't know when my surgery was, and they didn't call me until 1 o'clock to let me know what time my surgery was at. So they told me I needed to be at the surgery center at 11 o'clock to check in for surgery. So I showed up at 11 o'clock and I waited and I waited and I waited and I waited, and eventually the office was completely empty. Then I was called back into the pre-operative area. That process took a while as well. Of course, they are, taking some vitals and weighing you and taking your blood pressure and just double checking everything, checking and rechecking and making sure that you're supposed to be there and that they know what type of surgery that you're having and you know what type of surgery that you're having. Also, just to make sure that you've been following any kind of pre-operative instructions as well. So they were great though as far as making sure I was comfortable. So I had a little area that had a curtain and had a TV, so it was very comfortable. And actually this surgery center had this really cool gown that actually looked like a vacuum and had this heating element. So I always get very cold, but some of you might get really hot, and it actually had an adjustable knob on it, so you could actually push air into your gown, either hot air or cold air, so that you could be comfortable. I had never seen anything like that before, and I thought that was actually really cool because, the last thing you want to be is very cold sitting in a room or very hot right before your surgery. Now, after they put the IV on me and I met with the doctor and I met with the anesthesiologist so they could go over everything about the anesthesia, I was also given pain medicine prior to the surgery so that it would kick in by the time I was done with the surgery, which I thought that was helpful, so you're always kind of staying ahead of the pain. Now, my surgery though didn't even start until 3 o'clock. If you remember, I said I had to check in at 11. My surgery wasn't until 3. And the last time I had eaten or drank anything was at dinner time the day before. So I was like pretty hangry. I really wanted to eat something, and the fact I didn't have any coffee, didn't really like that either. But I got over it. So surgery went very well. It only took like 15 to 20 minutes for the actual surgery itself. But then you have to stay and make sure that you can wake up from the anesthesia, and I did have a general anesthesia. I noticed when I woke up from anesthesia that my throat was a little bothersome, and I guess that's pretty common of when they are doing the general anesthesia and putting the tube down your throat. That part I didn't really like either, because I've had general anesthesia before and my throat never really bothered me, but for this particular time it did. And actually it still is a little scratchy from 2 days ago, but it is getting better. So once I woke up from anesthesia, I was able to sit on the edge of the bed, and they gave me some liquid as well as a couple of crackers, and they wanted to make sure that I could, get up and walk around and use the restroom before I was discharged. And so really that evening of my surgery wasn't too bad. I was really more sleepy than anything. I think the anesthesia and then the pain medication that they had given me just made me very, very groggy. And so I got home, I was able to have dinner, and then went to bed without really any kind of problems. I didn't have to take any kind of pain medication or anything because I was still feeling the pain medicine from what they gave me before the surgery. However, I did fall asleep, but yet I didn't sleep for long. So I woke up pretty early in the morning, was kind of uncomfortable the rest of the day on day one. I sat around, didn't really do much, but as far as pain goes, I wasn't really hurting at all. I mean, it was a little uncomfortable, but I really wasn't having too much pain. So I got up and I was walking around and I was getting the day started, and even put a little bit of laundry in the washing machine and got my kids on the bus. And I think I overdid it, and I actually got very lightheaded, had to lay down on the kitchen floor, and I passed out. And I was kind of freaked out about that. And luckily I didn't fall. I put myself on the floor because I knew what was happening. I knew I was starting to get kind of lightheaded and dizzy, and I don't know if it was just a combination of me overdoing it, or lack of sleep, or the pain medicine, the anesthesia, probably a little bit of everything. I really took that as a sign that I better just kind of back off. And so I just went ahead and just took it easy the rest of day one. And so I got a decent night's sleep last night, and here I am today on day two, feeling pretty good. I'm trying to ice my shoulder every couple of hours just to make sure too that I can stay ahead of any kind of swelling and achiness. I am also just kind of wearing the sling as needed. The doctor did say around day 2 to 3 to just kind of start weaning out of the sling as well. So I'm going to be doing that here over the next couple of days, weaning out of the sling, as well as starting to do a little bit of incision care. And they did instruct me on day 2 that I could start to change my dressing. So I'm going to be doing that in another video, and we'll see how that goes. Now, if you care to follow along with a few more videos as far as my recovery goes, do check out some of those videos that I have linked here in this video. I hope this video helps you and provides you a little bit of information as far as what some things may look like for you when you are undergoing some shoulder surgery. If this video helped you, do give it a like, and don't forget to hit that subscribe button below. Thanks for watching.